Yes, good afternoon, class. I welcome you to our revision segment of first paper again today. I'm just having paper one or first paper here, first paper, and then I'm gonna do with you question 4 and 5 only, just for the interest of time, because I've seen that sometimes these papers are too long, hence they end up being too much. So please note that we are only answering question 4 and 5, please, class. We are only answering question 4 and 5 strictly for now in this presentation. So without wasting any time, I'm going to just go straight to the questions. I'm just going to go straight to the question that we should answer today so that we can not waste time. But anyway, you know very well that you should answer what you always know that your section A is compulsory. If it is a full paper, you answer in 3 questions of the 4 questions in section B. I'm sure these ones we know, and this is okay. So what I'm saying is, without wasting any time, let me just go to the questions that we should answer quickly. Uh, let's just go to the question that we must answer quickly. First question is saying, discuss the arrangements that should be made before a patient can undergo any operation. When a patient is to undergo an operation, what must be done? Discuss the arrangements that should be made before a patient undergoes operation. uh, the medical secretary must arrange for a bed in a hospital. The bed must be there in the hospital. Turn on the theater list. Turn on the theater list to ensure that the patient is appearing on the list of patients that are supposed to go into the theater, and then ensure the availability of a theater sister and nurses. The medical secretary must ensure that this sister the theater sister and nurses are available, and also arranging for anesthetic. It must also be there in order to ensure that the patient cannot suffer a lot of pain. And then arranging for an assistant to the surgeon, which also supposed to be part of the work that must be done there. Arranging for an assistant to the surgeon that must also be available, as you can look into these factors that we are referring to here. And then next question is saying, our next question is saying, explain how a cytogram is taken. I have been talking about radiography. If you can also refer to the channel, there are some points or some lectures that has been posted regarding radiography. So explain how a cytogram is taken. It is the radiograph of the gallbladder. It is the radiograph of the gallbladder after it has been made visible by a contrast material. We said that hollow organs, when they are to be taken, uh, what to call X-rays, they need to be given what they need to be. They must be in administration of a contrast material. The preparation of the patient includes a light fat-free meal in the evening. The patient must have a a light fat-free meal in the evening before, that is before, and then existing many out of fruit and vegetables prepared without butter and fat. As we say that it must be light fat-free meal. Hence, they must be without butter or fat. The meal must have no butter and fatty. The radio opaque material or colorant, as it is also known, is usually taken in the form of tablets. It can be taken in the form of tablets just after a meal. The tablets are usually taken a few minutes after each other. They are not taken all of them once off. They are taken a few minutes after each other. And also the patient must realize that it may have a relaxative effect, just to make the patient to relax. Thereafter, no food or water may be taken. We are talking about the X-ray of the gallbladder. When the current has been taken, no water or no food must be anywhere eaten or taken. The X-rays are taken the next morning, about 12 to 14 hours after the tablets have been taken. This also comes on multiple choice or true or false questions in terms of the hours, in terms of the duration, which is the waiting period. 12 to 14 hours after the tablets have been taken, that's when the X-ray is taken. Thereafter, the patient must enjoy a fat meal, something like eggs, buttered toast. We are saying after the X-ray has been taken, the patient can therefore eat a fat meal, and then which can be comprising of eggs, toasted butter, and so forth, buttered toast. The reason for this is to stimulate the gallbladder to rid it or to rid it of its content. About 1 hour after this, another radiogram is taken to evaluate the functioning of the gallbladder. So what we are saying is that after the gallbladder, after the operation or everything is done, an hour after, there is another function, another radiography that is taken in order to ensure that the gallbladder is functioning. That is a question that you need to know. Name the different areas where temperature can be taken. Areas where temperature can be taken. Temperature can be taken where it can be taken in the mouth, which is under the tongue. It can be taken in the osco of babies and also unconscious patients. It can be taken in the rectum of babies and very ill patients again, in large intestines or towards the anus there. That's where the temperature can be taken again. You need to understand again for which patients. There is, we are saying very ill patient and also uh, young babies. In the vagina to determine when a woman is ovulating, it can also be taken, temperature can also be taken there to determine when a woman is ovulating. Explain how breathing should be observed. Explain how breathing should be observed. Explain how breathing should be observed. Bend the patient arm. Bend the patient's arm over his or her chest and hold his wrist, like when determining the pulse rate of the patient or of the person. Count the movement of the thorax for 30 seconds and then double the amount. You count the movement of the thorax in 30 seconds and then you double the amount that you get. You double it just to make sure that you get a correct reading. If in the case that the patient breathing is very weak, hold your fingers in front of the patient's nose and feel their air that is being released, that is being exhaled. It is also another point that you need to take note of. Question 5. Which factors are important when opening a new practice? Factors that are important when opening a new practice. 8 marks. When a doctor commences a practice in a certain area, he should, as a matter of courtesy, inform the colleagues. Colleagues must know in the immediate vicinity accordingly. When a new practice is to be started in a new area, the doctor must inform his colleagues that are within that area. That is for courteous functions or for courteous reasons. However, the ethical rules of the South African Medical and Dental Council specify that such a communication may only convey the fact that he or she is commencing a practice in the area, and in the case of a specialist, that he is commencing practice of his specialty. The communication must be conveyed in order to ensure that the other people or practitioners in the area are aware of the specialty which is to be started there. The communication may be sent in a plain sealed envelope only, bearing no more than the name and address of the doctor who is to start that, to whom it is addressed, and also communication may not contain any reference to a practitioner's expertise or a special field of interest. They may not also be contained there unless these can be registered with the South African Medical and Dental Council. So this is also a very common question which you should take note of. Factors to consider when a new practice is to be started in an area. Take note of that. And then the next question, and then I'm saying the association will not fault a practitioner for paying goodwill visits to other practitioners in the area, provided that he does not contravene the ethical rule with regarding to advertising. Advertising, I'm sure that you know that we must not underplay, we must not in any means contravene or try to downsize the businesses of other practitioners who are in the area. Should a doctor wish to commence practice in an where area he had been employed as an assistant or as a long-term tenant, he must obtain written consent from the practitioner for whom he had acted in that regard. The doctor who is to start the same a practice which he is practicing in the area, he must obtain a written consent in approval class. This is an approval from the patient that he was working from. Doctors who make use of the services of a local tenants are advised to safeguard themselves by means of a stipulation in a written contract with a local tenant prohibiting the latter from commencing practice in the vicinity within the specified period after the termination of service. So it is also possible that a doctor cannot be allowed to practice any of his services within the area that he was practicing as a prohibition until a certain period of time that is prohibited or that is stipulated in the contract. And then which matters must appear in a contract between the doctor and the assistant. What must appear in a contract between the doctor and assistant? These are to do with the relationship between the practitioner and the professional assistant in his service is that of an employer and employee, and the agreement must between the two parties is a service contract where the employee in the execution of his duties places himself under the authority and control of the employer. So what is being said here is that a doctor and an assistant have got an employee-employer relationship where the contract is to also give the capacities and also the degree of execution of duties which the assistant must do under the authority of his employer. It is always advisable to enter into a written contract anyway, in which the following should be stipulated. The period of contract or period of employment must be there, which also identifies the salary. The job description must also be there. Limitation on outside activities. What areas, which activities must not be done by the assistant. A ban on the divergence of confidential professional information, as to say that there is confidentiality form clause that must always be there regarding the practice of the employer, and a clause limiting the employee from setting up practice in the same area for a certain period after expiry of the contract, to say that the assistant as employment has been terminated. There is a period of service which that assistant cannot practice or cannot start his or her own business within that vicinity. And then explain informed consent. An informed consent, this implies that the patient has been given all the necessary information, which includes the fair explanation of the nature and purpose of the operation that the patient is to undergo, procedures, the possible alternative treatment that the patient can also get, the risks involved in the operation, they must also be stated or be explained, and the possible consequences and complications of such operations. So an informed consent, it is an agreement that is showing approval of procedures that the patient has been given all the necessary information with regard to the operation that he or she has to undergo, including the way the treatment is to be done, the risks that are to be involved, the consequences that might also arise, as well as alternative ways of treatment to the disease. So therefore, the patient has to conform, has to approve. In terms of that, it is always given in writing, which the patient has to sign. And then, what is the meaning of SAMDC? What does it stand for in medical practice? It stands for South African Medical Dental Council. South African Medical Dental Council That is the meaning of this. South African Medical Dental Council, it is the meaning of SAMDC, South African Medical Dental Council. I'm sure that you have seen it quite a lot of times in various papers. So please take note of this. I just said for the interest of time, I'm dividing the paper into two, so then it cannot be too long. Thank you so much for watching and have a beautiful day. Let's meet in the next segment. Thank you.